You've been paying into the system for decades, and finally, there's something worth celebrating. The Social Security Administration just announced adjustments for October 2025, and thousands of retirees are about to see real changes in their monthly checks. But here's what nobody is talking about. Not everyone qualifies for the same increase, and the difference could mean hundreds of dollars every single month. Right now, across America, seniors are logging into their accounts and discovering payment amounts that don't match what they expected. Some are seeing increases based on cost of living adjustments, while others qualify for additional payments they didn't even know existed. The confusion is real, and the SSA isn't exactly making it easy to understand who gets what and why. If you've worked 35 years or more, if you delayed claiming benefits past your full retirement age, or if your income falls below certain thresholds, you need to hear this. The October adjustments aren't just about inflation. They're tied to specific qualifying factors that could impact your financial security for years to come. Let's break down exactly who qualifies, what amounts you should expect, and the 3 critical things you need to verify in your account before this month ends. Let me tell you something that most people don't realize until it's too late. The Social Security system operates on a complex formula that takes into account your entire working history. And October 2025 brings changes that affect different groups of beneficiaries in completely different ways. The truth is, your neighbor down the street might be getting a substantially different increase than you are, and it has nothing to do with luck or favoritism. It's all about understanding how the system calculates your benefits and what specific categories you fall into based on your work history, age, and current benefit amount. The Social Security Administration has been working behind the scenes for months to implement these October adjustments, and the numbers are finally here. We're looking at modifications that stem from the annual cost of living adjustment, or COLA as it's commonly known. But there's so much more to this story than just a simple percentage increase across the board. The federal government reviews economic indicators throughout the year, including the Consumer Price Index for urban wage earners and clerical workers, which sounds like bureaucratic jargon, but actually measures the real cost of things you buy every day like groceries, utilities, healthcare, and housing. When these costs go up, the SSA is supposed to adjust benefits accordingly, but the timing and implementation of these changes can vary dramatically depending on your individual circumstances. Now, here's where things get interesting and where many seniors miss out on money they're entitled to receive. If you started collecting Social Security before reaching your full retirement age, which for most people born after 1960 is 67 years old, your benefit calculation works differently than someone who waited until full retirement age or even delayed benefits until age 70. The system rewards patients with higher monthly payments, and those who delayed are now seeing those rewards compound with the October increases. Every year you waited past your full retirement age resulted in an 8% increase in your base benefit amount, and now that base amount is getting adjusted upward again. This means if you're someone who strategically delayed claiming benefits, you're looking at increases that build on an already elevated payment structure. But let's talk about the folks who claimed early because they needed the income or thought it was the right move at the time. Your benefits are still increasing, absolutely. But the percentage applies to a lower base amount because of the early claiming reduction that was permanently applied to your account. This doesn't mean you made a wrong decision necessarily, because everyone's financial situation is unique, and sometimes you need that income right away. But it does mean your October increase might look smaller in dollar terms compared to someone who waited. The Social Security Administration doesn't advertise this disparity very loudly, and many retirees are surprised when they compare notes with friends and discover significant differences in their payment adjustments. There's another critical factor that almost nobody discusses in mainstream coverage of Social Security changes, and that's the earning history requirement. The SSA looks at your highest 35 years of earnings when calculating your benefit amount. If you didn't work a full 35 years, or if you had several years with very low or zero earnings, those zeros get averaged into your calculation and drag down your overall benefit. The October adjustments apply to whatever your calculated benefit amount is. So if your base was lower to begin with because of gaps in your work history, your increase will reflect that lower starting point. This is particularly relevant for women who took time off to raise children or care for elderly parents, And for anyone who experienced extended unemployment or career interruptions due to health issues or economic downturns. The government also considers your current income when determining certain supplemental payments that coincide with these October changes. If you're receiving supplemental security income on top of your regular Social Security retirement benefits, the calculation becomes even more nuanced. SSI is need-based, which means the amount you receive depends on your other income sources and your living situation. When your Social Security benefit increases in October, it can actually affect your SSI payment because the program sees that additional Social Security money as increased income. The net result might not be as large as you anticipated if you're receiving both types of benefits simultaneously. And this catches many people off guard when they see their actual deposit amounts. Medicare premiums are another piece of this puzzle that deserves serious attention because they're directly deducted from your Social Security payment before the money ever reaches your bank account. The standard Medicare Part B premium for most beneficiaries has been adjusted for the coming months, and while there's something called the hold harmless provision that's supposed to protect most Social Security recipients from seeing their net payment decrease due to Medicare premium increases, there are exceptions. If you're a higher income beneficiary subject to the Income-Related Monthly Adjustment Amount, known as IRMA, your Medicare premiums are substantially higher, and these get deducted first. New enrollees in Medicare also don't have the hold harmless protection during their first year. This means your gross Social Security increase might look great on paper, but after Medicare takes its share, the amount hitting your account could be less impressive than you expected. Let's address the specific qualifying criteria that determine whether you're eligible for the maximum benefit increase available in October 2025. First and foremost, you need to be currently receiving Social Security retirement benefits or survivor benefits. If you haven't filed for benefits yet, these increases don't apply to you until you actually start receiving payments, though your eventual benefit will be calculated using the updated formulas and wage indexes. Second, your benefit amount must have been established under the current calculation system, which means if you're receiving benefits based on a very old claim from decades ago, there might be additional adjustments or recalculations that need to happen. Third, you cannot be in any kind of suspended payment status due to excess earnings, which happens when people continue working while receiving benefits and earn above the annual limit before reaching full retirement age. The earnings limit is something that trips up a lot of people who thought they could supplement their Social Security by working part-time or doing consulting work. For 2025, if you're under full retirement age for the entire year, the Social Security Administration will deduct $1 from your benefits for every $2 you earn above the annual limit, which is set around $22,000 but gets adjusted yearly. If you reach full retirement age during the year, the limit is higher and the deduction rate is different. And once you hit full retirement age, the limit disappears entirely. If you've had money withheld because of the earnings limit, the October adjustments might restore some of those funds or adjust your future payments accordingly, but it requires understanding exactly where you stand in relation to these thresholds. Divorced spouses represent another category that often gets overlooked in discussions about Social Security changes. If you were married for at least 10 years and meet certain other requirements, you may be eligible to receive benefits based on your ex-spouse's work record even if they've remarried. The October increases apply to these spousal benefits as well, but the calculation is different because spousal benefits are capped at 50% of the worker's primary insurance amount. If your own work record would provide a higher benefit than the spousal benefit, you'll automatically receive the higher amount. But many people don't realize they have options and never explore whether claiming on an ex-spouse's record might be advantageous. Survivor benefits operate under yet another set of rules that affect how the October adjustments impact your payment. If you're receiving benefits as a widow or widower, you might be getting anywhere from 71 to 100% of what your deceased spouse was receiving or entitled to receive, depending on the age at which you claimed survivor benefits. These benefits also receive the October cost of living adjustments, but the amount you see depends on whether you've reached full retirement age and whether you're also receiving benefits based on your own work record. The SSA has complex rules about how these benefits coordinate, and sometimes taking survivor benefits first while letting your own benefit grow until age 70 is the optimal strategy, but it requires careful planning and understanding of how the increases compound over time. Direct deposit is absolutely essential for ensuring you receive your October payments without delay. The Social Security Administration has been pushing beneficiaries toward electronic payments for years now, and paper checks are becoming increasingly rare and problematic. If you're still receiving paper checks, you should seriously consider switching to direct deposit because it's faster, more secure, and eliminates the risk of checks getting lost or stolen in the mail. Your payment date depends on your birth date, with payments typically going out on the second, third, or fourth Wednesday of each month for retirement beneficiaries, though SSI recipients receive their payments on the first of the month. The October adjustments should be reflected in your regularly scheduled payment, and you can verify the amount by checking your My Social Security account online before the money hits your bank. Speaking of the online account, if you haven't set one up yet, you're missing out on a powerful tool for monitoring your benefits and catching errors before they become major problems. The My Social Security portal allows you to view your payment history, see your earnings record that the SSA has on file, estimate future benefits if you're not yet claiming, and most importantly, verify that the October adjustments have been correctly applied to your account. Mistakes happen more often than you'd think, and sometimes earnings from decades ago are recorded incorrectly or payments get calculated using outdated information. Having online access means you can spot these issues immediately and contact the SSA to get them resolved rather than discovering months later that you've been underpaid. The reality is that Social Security changes affect everyone differently, and these October adjustments are no exception. Your unique combination of work history, claiming age, current benefit amount, Medicare premiums, and other income sources all factor into the final number that appears in your bank account. Understanding these variables puts you in control of your retirement income and helps you plan more effectively for the months and years ahead. The good news is that these increases are coming. They're designed to help benefits keep pace with rising costs, and most beneficiaries will see at least some boost in their monthly payments starting this October.